Hello, welcome to today's lecture. From the name Arthropod. So arboviruses are these are examples of the arbovirus families. So first we'll talk about Virology. So sandfly fever or Papuasi fever. We have different serotypes of that. This is here an outbreak of sandfly that was the sandfly fever is from the name. So next we will talk about flaviviridi viruses. So we have the West Nile virus was first isolated in a woman. The virus transmits to the host during the blood. So it's important to note that we don't have currently specific treatment for West Nile virus. So now we'll talk in terms of symptoms. So really one of So this is here a geographic spread of the Aedes mosquito. Now dengue has been on the rise. The incubation period of dengue can be up.
The disease or the illness starts with an influenza-like illness. So fever, chills, headache, severe pain in the legs and the joints. That is within the first few hours. And also this characteristic retroorbital pain when moving the eye. It's also known as break-bone fever. So patients have a very severe lumbar backache and the inability to stand up straight or severe prostration, which begins abruptly following onset of symptoms. The illness also have this saddleback pattern, which means that the symptoms oscillate in episodes lasting of 2 to 4 days, following which the patient would have profuse sweating, and then these symptoms might occur again. Now, patients who progress to the severe disease, and this would be usually the patients who have been previously exposed to another serotype of dengue. These patients might have severe plasma leakage due to the involvement of endothelial cell lining of the blood vessels, accompanied by dengue shock syndrome or DSS, and fluid accumulation with respiratory distress. And in one of the most severe forms, we can see severe bleeding, similar to what we're seeing in this patient here. This is the arm of the patient with subcutaneous hemorrhage, and this is known as dengue hemorrhagic fever. Unfortunately, we don't have antivirals for dengue, so the only way to manage the patients is to provide them with supportive therapy and painkillers. In terms of diagnosis, dengue can be diagnosed by, like other viruses, real-time PCR or rapid antigen detection. And also we have the ability of doing serological testing, especially when we want to know the specific serotype that's infecting the patient. The good thing is that until, for many years, the only way to prevent dengue fever was through really insect control, like using nets to prevent mosquitoes and from biting the individuals, or by using these insect repellents like DEET. However, we have now a vaccine for dengue fever, which is a live attenuated vaccine that contains the 4 serotypes of dengue, and this is important because we need to prevent infection by all serotypes, particularly to prevent the most severe forms of illness. And this is available for children and above, and particularly recommended for those who had a previous infection with dengue.
In the Togeviridae family, we have 2 alpha. Chikungunya is also transmitted by mosquito, the same mosquito. Rodent-borne viruses. So we mentioned about hantavirus, so the early symptoms of hantavirus disease are. So we'll talk. Ebola is one of the important re-emerging viruses. So from the name, the virus. So outbreaks continue to happen due to Ebola virus. So as we mentioned, the incubation period can be between. Until recently, there was no approved antiviral drug treatment for Ebola, despite its significant burden in particularly Africa, as I mentioned before. So symptomatic treatment, and still symptomatic treatment, is very important for preventing death by Ebola. This is done by replenishing the lost fluids and supporting or maintaining the level of oxygenation in the body by providing intravenous fluids and balancing electrolytes, maintaining the oxygenation status and the blood pressure, as well as treating other infections if they occur by antibiotic treatment. So recently, monoclonal antibodies have been approved. These include the Ibanga, which is made of ansi-Vimab. So again, this is a monoclonal antibody targeting the surface glycoprotein of Ebola, so it blocks the entry of the virus. This has been shown to be effective in clinical trials. The other approved drug is made actually of a cocktail of monoclonal antibodies. It's called Nmazeb. It's made of 3 monoclonal antibodies, Atolotivimab, Maftivimab, and Odicivimab. I don't want you to memorize the monoclonal antibodies names included in each of these drugs. Now, so you're all familiar probably with the drug Remdesivir that was approved recently for COVID-19. So this was one of the drugs that was actually also tested for Ebola, but it was dropped because these monoclonal antibodies were found to be superior in efficacy and clinical benefits compared to Remdesivir. So they were chosen as the drugs of choice for Ebola treatment. Also recently, a vaccine has been approved for Ebola. This vaccine is called Ervebo. It was developed by Merck. It has an efficacy of 97.5%, and this vaccine has been shown to be very efficacious, particularly when used as in a strategy called the ring strategy, whereby those who have been exposed to an infected case are directly vaccinated, and then those who are exposed to that first circle of exposed people are also vaccinated. So this way we directly contain or quickly contain the outbreaks. So this vaccine is made of a recombinant vesicular stomatitis virus, which expresses the surface glycoprotein of the Ebola virus. The other vaccines are being developed, including one by Johnson & Johnson that is based on adenovirus serotype 26, and this vaccine also is promising. I included at the end of this lecture some additional reference material. Of course, you can look. So for diagnosis of Ebola, just like other viruses, here this map shows you the areas where Zika. This map here shows you the spread of AIDS. This is just kind of a historical map of how